Today we're going to be talking about a really exciting topic, which is the development of a new clinic here at the James that's entitled the James Cancer Hospital and Solove Research Institute's James Cancer Diagnostic Center. This is a clinic that opened up on Monday, June 15th, so a week ago, with the intention of trying to identify patients that have cancer and to get them quickly evaluated and then directed to the appropriate specialist oncologist here at the James. And we'll talk a little bit more about that over the next 10 minutes or so. I want to remind everybody that if there are questions or comments that you have, please put them into the chat section. I'd be happy to try to address them during the time that we have today, or we can always follow up afterwards. So let's start about why it would be that we would have an interest in actually opening up a cancer diagnostic center. At the James Cancer Hospital, we are known for, treating cancer. We're also known for preventing cancer. But in terms of the diagnosis of cancer, very often that's done in the community. What we realized is that the access to cancer diagnostic services in the community is somewhat limited. It may be limited by the fact that there may not be access from patients to the diagnostic testing centers. It may be that patients may not have access to a primary care provider for a variety of reasons. And it could also be that there may not be the expertise in a community to be able to perform the right level of testing that's required for somebody to actually diagnose an individual with cancer. And so we realized through the process of COVID-19, through the pandemic, that access to a lot of different medical services was severely limited. Sometimes that was limited by the government actually saying you cannot have an operation, or that you can't continue to see patients face to face, or that certain radiology testing was thought to be too risky during the pandemic until we had better information about whether or not there was enough personal protective equipment, things that we've talked about on this segment before. And because of COVID-19, we realized that access has always been a problem, and access was actually even worse during the peak of the pandemic. At this point in time, it's still getting better, but we still realize that there are substantial problems with access to cancer diagnostic services. So let's talk real briefly about a couple other pieces. We talked before on this show about cancer screening, and that's colonoscopy for colon cancer, mammography for breast cancer, and pap tests for cervical cancer, for example. These are issues that have really been critically important, that a lot of patients, a lot of individuals did not actually go for their screening tests. Those are still critically important, but that's not what we're talking about here. Screening is where you identify patients that, we're trying to pick up things that are precancerous and trying to get them evaluated and managed to keep them from turning into cancer. This is the importance of early diagnosis. So how do you gain access to this clinic? If somebody has, for example, a chest x-ray that shows a lung mass, or a CT scan of the abdomen or pelvis that shows a liver mass, or something that a primary care provider feels on examination that's worrisome for cancer, but they don't know where to turn, or they don't have the ability to send a patient for that diagnostic testing, then they can be sent to the James Cancer Diagnostic Center for that next step, for the evaluation, so that our expert team of advanced practice providers that have experience and expertise in oncology care, that's backed by physicians that have that same level of expertise and experience, can then refer that patient on to the appropriate, limited number of testings that are required to make that diagnosis of cancer. And then they're also going to be responsible for the follow-up of that patient, and then the referral of that patient to the appropriate oncologist if a cancer is diagnosed. Our hope is that we will not find a cancer, obviously. Not everybody that has something suspicious is ultimately going to be diagnosed with cancer. But let's say that someone has a lung mass that turns out to be not cancer. We've got experts at the Wexner Medical Center that our team would refer the patient onto for not cancer services, but for other lung disease services that are still expert within the Wexner Medical Center. So it's just as a matter of trying to figure out in a timely fashion what does the patient have, and what is the process by which we can get them into the appropriate level of medical care as quickly as possible. So this is the exciting part about timeliness. So we understand that timely diagnosis of cancer is critically important. The earlier a cancer is diagnosed, then the higher the rate of cure. So if we can find patients at the earliest stages and not delay the diagnosis, their prognosis could be better. So we're offering same day or next day consultations. This is really exciting so that we're kind of eliminating the barrier that sometimes we see, which is we can get you in, but it's going to be a week, it's going to be a month, or it's going to be longer. And sometimes patients that have that, it obviously is anxiety provoking to have that delay. And sometimes patients, when they hear that, kind of say, I'm not going to really worry about that. I'm going to push it off. If it's going to take that long, I don't want to deal with this now. So same day, next day referrals, seeing the patients in the clinic, getting them evaluated for that right diagnostic testing, and then get them into the expert oncologist, or again, hopefully not to an oncologist, but to an expert physician or practitioner that can evaluate the patient for what that diagnosis is made. I think really importantly, this is not a second opinion clinic, meaning if somebody has a diagnosis of cancer that's in a health system already, this is not the place for that patient to go. We already have a process that exists within the James and many other medical centers where a patient can always seek second opinion care. And again, we always encourage patients to consider a second opinion. If we make the diagnosis, seek a second opinion elsewhere to make sure that you're comfortable with the treatment plan that's established. But likewise, if a patient wants a second opinion at the James, we've got a process that exists independent of the diagnostic clinic as well. But this is a really unique opportunity to develop this type of a clinic within Central Ohio. We're not aware that this exists. There are some models across the country where this does exist that we've kind of gotten some guidance through the process and found some significant benefit. And I just want to say that in the first week this was open, we heard from the patients that sought the care that there were delays that were out there, that they were, told by their providers that they could get that diagnosis, but it might be a month or more. They might get back to their doctor, but it could be weeks and weeks. We saw the patient same day, next day. We got them in for the appropriate diagnostic testing that same day, and we actually made very quickly 2 cancer diagnoses that would be delayed substantially had this clinic not existed. The other thing that's really, really important is to recognize that this clinic is for anybody that has a concern for cancer because of something on x-ray or lab test or examination. Meaning we understand that access is an issue for all of our patients in all of our communities. And I just want to mention that COVID-19 highlighted significant healthcare disparities between our low socioeconomic status communities here in Columbus and elsewhere, that access to care was limited, and also obviously there was a increase in the rate of complications and an increased rate of COVID in these populations as well. And so it's really critically important that all of our communities have access to this clinic. Patients can refer themselves, or they can be referred by their healthcare providers as well. And I'm going to throw out a phone number here for those types of referrals. I'm going to say it a couple times. Here's the first one. The James line is the telephone number that we're utilizing for triage into this clinic. The James Cancer Diagnostic Clinic is the name, and the James line phone number is area code 614-293-5066. One more time, area code 614-293-5066 is the telephone number to access the James line, and then that'll get you into the James Cancer Diagnostic Clinic for all of our communities that have challenges with access or that have a concern about a malignancy or cancer that need further diagnostic testing. So we've already demonstrated that this does provide value to our community. The earlier that a cancer is made, the higher the probability of cure, and also the lower the rate of anxiety just waiting for something to occur. And we hear that over and over again from many of our patients that come in. So I'm going to take a look at a couple questions here. And so wonderful news. I agree. This is really a great opportunity to cut out precious time and to get a diagnosis quickly. We had heard from when we announced this clinic, individuals had questioned through a variety of outlets whether or not someone who has a lung mass would be appropriate for this clinic as well. And what I'd say is that if you have a mass on a lung that your doctor or your healthcare provider is worried that this could be cancer, and there's uncertainty about what to do, or there's a time lag for doing something, you can always call the James line, 614-293-5066, and get into the James Cancer Diagnostic Clinic so that we can perform that evaluation and get you on for the appropriate diagnostic testing. So I hope that this was educational and informational. Again, this is a community service that we're going to hopefully continue to expand our reach, and recognize that the earlier that we can make a cancer diagnosis, the better it is for our patients and the better it is for our entire community. So I hope everybody continues to be well. COVID is still out there. Just want to kind of make a plug for physical distancing, hand washing for 20 seconds with soap and water, hand sanitizer if you don't have soap and water, and wearing a face mask when you're in public, just to cut down that transmission between individuals. As the state is opening up more, as the country is opening up more, I just hope everybody does not let their guard down. And I think most importantly, I hope that everybody continues to access health care that's going to allow our communities to be as healthy as they can be going forwards.